rise to present to you SCR 154, declaring August as Valley Fever Awareness Month.
My cousin contracted valley fever and died.
My headache went away in May, so I only had it for about 5 months.
The disease goes to your brain, your bones, your liver, anywhere it wants to.
It's been just great to see this kind of turnout and support, and I feel so very proud to be able to help our residents with valley fever.
Valley fever is caused by a fungus that grows in the soil with the difficult to pronounce name Coccidioides imidis. It grows up out of the dirt. It's sliced off by a breeze. It runs around in the air. It can go 75 miles. You breathe it in. It impacts in your lung. And in 6 out of 10 people, nothing happens. But in 4 out of 10, they get sick. In 1 out of 10, you're very sick. And in 1 out of 100, the disease goes to your brain, your bones, your liver, anywhere it wants to. For the 60% that didn't get sick, they don't have symptoms. Of the 40%, most have cough, fever, lassitude, rash, body ache, joint ache in particular. Well, there's certainly treatment. We have a number of drugs, but they're expensive. You have to take them a long time, and they're not as successful as we would hope. They're not as potent as we would hope. There is no prevention, and the word cure is not used for this disease.
Rob and Wendy Purdy have faced the devastating effects of valley fever on a very personal level. Rob is currently the president of the Valley Fever's America's Foundation and survived one of the most severe cases of valley fever. He will require lifelong treatment because though you survive, you are not cured.
So in 2012, New Year's Day, I woke up with a hangover, which sounds really good and like a good story, except I didn't drink the night before. So what I really had was the onset of cocci-meningitis, or the meningitis form of valley fever. So for about 6 weeks, I went to a couple urgent cares, was given 2 courses of antibiotics. They didn't help. I was basically mostly bedridden that entire time. Horrible headache was my main symptom. Since then, I've been in and out of the hospital a couple times. So the first time was October 2012. I went back in the hospital. By the way, my headache went away in May, so I only had it for about 5 months. So October, I went back in the hospital. The drugs weren't working. They changed my medication. I got out of the hospital, went around again. And then I got this, my little unicorn horn. So my unicorn horn is because none of the oral medications penetrate what they call the blood-brain barrier well enough to control my valley fever. So they give me this drug called amphotericin B. So Dr. Heinz Einstein, who we're highlighting here today, pioneered this drug in the 50s, and that's the reason I'm alive today. So I get that drug. I started out twice a week getting this drug. Now I only have to get it once a month. So I get like a little booster shot or a jumper cable.
Several years ago, my cousin, who I grew up with and was very close with, was a year younger than me, and he contracted valley fever and ultimately died from the disease. And so it had a significant impact on me because I didn't know what valley fever was then. I was in my late 30s. And then recently, my significant other contracted valley fever. And she struggled with it, still does today, a year and a half later, with having breathing issues. So it really has a significant impact. I went and got tested because I wanted to know if I had it so that I would have a little bit more peace of mind while I was out hiking. And I had it. I tested positive. So it kind of helped me know that I probably won't get it again and probably don't have to worry as much about it. But I think that the testing is a big part of what people need to do so that they know. Ultimately, we're hoping there's a vaccine because this is a killer disease. It's a disabling disease, and it impacts not just the person that has it, the entire family, because you now have to do all the things that they can't do for up to a year. And so it really, I hope people become aware of what this disease really is.
Here's what you really, to me, the core thing to know is your symptoms are not going to be descriptive enough that you're going to have a light bulb on your head that goes off that says valley fever, test me. So what I really try to impart to people is if you've taken a course of antibiotics, before you let them give you another course of antibiotics, you're going back to the doctor anyways. They're going to take your blood, have them check it for valley fever. 2 is if you're waiting to go to the doctor and it's been a couple weeks and you're not getting better or you're just beyond exhausted, that first trip to the doctor, ask them to test you for valley fever. And if they say, oh, you can't get valley fever, we're in LA or we're in the Bay Area, You know what, this thing travels. You've probably driven through Bakersfield even if you don't live here. You've driven through other endemic areas. Central Coast. You can't get from the northern part of the state to the southern part of the state and vice versa without driving through the central part of the state. Tell your doctor to test you. Insist on it when necessary.
So the Valley Fever Institute will have three key focuses on research. How do we find a cure? How do we prevent it? How do we develop a vaccine? We'll work very closely with the University of California system and Merced and UC Davis and UCLA to bring the greatest minds we can. How do we treat it? We have to educate the other physicians, the other members of the community to look for the signs and symptoms of valley fever. And then those who contract the disease, how do we treat them? So we're research, education, and treatment.
We were able to get a significant amount of funding to support valley fever research that goes to Kern Medical to establish their Valley Fever Institute. And so we're going to continue the work moving forward to help improve the quality of life of everyone in California.
This has been a very, very meaningful conclusion for me to see everybody starting to understand the need for this money and to build facilities and resources that help our patients.